Welcome once again to my YouTube channel. And in succession to the topics what I have been taking up, today's topic of the discussion, I'll be mainly focusing upon what is tetanus, the clinical manifestations of it, and what are the types of tetanus. So students, my main focus will be on the competitive exams, whether it be the NEET PG entrance exam or whether it be the pharmacy or the nursing entrance exams, wherever the questions, the frequently asked questions what are being asked there, if it is related to tetanus. So the main striking distinguishing points I'll be focusing upon as to from where the multiple choice questions can be framed. So students, in this video, I'll be mainly talking of the most important. I'll be trying to explain you in sequence as to what is tetanus, what are its types, what are the clinical manifestations, what are the medical terminologies associated with it. So this video, this will be entirely dealing upon the striking distinguishing facts on which the multiple choice questions in the competitive exams are framed. So students, beginning with, so tetanus, the word itself is suggesting tetanus for a layman or in a general terminology, it means locked jaw. So you might be very well aware that during your childhood days when you were not a medico, being not a medico, whenever people say tetanus, so it something refers to condition in which there is locking of the jaws are unable to open. So that in medical terminology, this locking of the jaw, you might be very well aware now that this has been called as trismus. So this trismus is just because of the symptom what is being manifested in the patients of tetanus who have tetanus, and more or less along with the locked jaw there is going to occur the pain and the stiffness in the neck, back and the abdomen as well. So for a layman or in general terminology, the word tetanus, most of the people they only visualize it in the form of locked jaw. Now since we are medicos, so our approach has to be different, and now we'll get into as to how this tetanus is occurring, how it is happening. So beginning with, so firstly, how this tetanus is caused. Most often whenever we get a wound, whenever we get injured, so whenever we reach a doctor, even with a cut with a knife, if we have any sharp object, if we get a cut through, even if we fall in road traffic accidents, whenever there is any kind of an injury during any sporting activities in soil, in mud, on road with sharp objects, whenever there is any kind of a cut, the doctor advises us to for us to get a ATS, that is the anti-tetanus serum injection, ATS injections he advises. So actually what is happening is, whenever during any kind of an injury, whether it be any kind of an injury, whether it be of any of the causes, whether it be road traffic accidents, falling down in a ground, any sporting activity, what happens is there are minute bacteria, and the bacteria what is responsible for tetanus, it is the Clostridium tetani. So Clostridium tetani, this is being very commonly found during even in the roadside or in the even in the playgrounds, in the mud, in the manures. This Clostridium tetani is very abundantly found. Now what happens is, when any kind of a bruising or laceration occurs during any kind of a fall or an injury, what happens is this Clostridium tetani, it gains access into the bloodstream. It gains access through the cut or the wound into the bloodstream, and this starts producing toxin of itself. So students do remember that this Clostridium tetani, when it gains entry into the bloodstream, it starts producing toxins of its own, or even at the surface of the cut wound, if this Clostridium tetani is adhering to it, it starts producing a toxin. And this condition of a bacterial cell, when it starts producing toxin, this has been referred to as toxemia. So tetanus has been defined in medical terminology as a condition of toxemia due to absorption of the soluble toxin. That is, it is an exotoxin from the wound of a contaminated with Clostridium tetani. So Clostridium tetani is the causative organism, and in any of the wounds which has been infected by Clostridium tetani, the Clostridium tetani bacteria starts producing a toxin. The condition when it spreads to the blood, it has been called as toxemia, and through this bloodstream, the tetanus toxin, it gains access into the body. Now, what about how in the medical in the MCQs they can very frequently ask you that when you are saying Clostridium tetani, what kind of a bacteria is it, how is it shaped? So Clostridium tetani, it is a gram positive bacteria. Do remember, it is an anaerobic rod, and this anaerobic rod, most commonly asked MCQ in the multiple choice question is that the drumstick appearance is seen in which of the following bacteria. So this Clostridium tetani, it shows somewhat a drumstick appearance, and it is very abundantly found in manures and soil. The striking characteristic feature of this bacteria, it is that it thrives in low oxygen tension. So wherever the oxygen tension is low, it is going to thrive, it is going to survive very well, really well it survives. So now, coming on to what is the toxin, how is this toxin is getting access into the body, and what are the types of the toxin what is being produced by this Clostridium tetani. So particularly there are two toxins what are being produced from this Clostridium tetani. That is, first it is the tetanospasmin, and the next it is the tetanolysin. So do remember students, it is the Clostridium tetani, it produces two types of toxins. First it is the tetanospasmin, and next it is the tetanolysin. Now, what is the nature of this tetanus, this toxin? The tetanospasmin is having, it is a particularly a neurotoxin, and since it is a neurotoxin, it is going to affect the nerves, and it acts on the motor end plate. So the nerve fiber is there, the end terminals of the nerve fiber of the cell body or the neuron, the end terminals, the motor end plate of the cell neuron or the cell the neuron, it is going to, this tetanospasmin being a neurotoxin, it acts on the motor end plate, whereas the tetanolysin, so tetanolysin, it is another toxin what is being produced, and this toxin is particularly an oxygen labile, means the presence of oxygen degrades it or breaks this down, this toxin. So tetanolysin, it is an oxygen labile, means it is broken down in the presence of oxygen. That is, it is not stable in the presence of oxygen. So it is an oxygen labile, and it is a hemolytic toxin. So it particularly, it acts on the blood. Now moving on, what about how this toxin, that is either the tetanospasmin or the tetanolysin, how they are going to elicit the mechanism of action? Because in tetanus, students, you all might be very well aware that there is going to occur reflex spasm of the muscles, of the voluntary muscles anywhere. What is the clinical manifestation of tetanus? That it causes sudden reflex spasm of the muscles. And how the spasm of the muscles is occurring, now we are going to have how this tetanospasmin, the tetanolysin, the toxins of this Clostridium tetani is going to elicit the reflex spasm of the muscles. So students, for this, either do remember that the toxins of the Clostridium tetani, it reaches the central nervous system either by two ways. Firstly, either it can travel through the bloodstream. That first traveling of the toxin can be through the bloodstream, and next this toxin of the Clostridium tetani, it can travel through the motor nerves along their axon cylinders. So students, you all might be very well aware that in the structure of a neuron, there is a cell body or the cyton, and from there it extends the axon or the axon cylinder. So what is happening is that the toxins of this Clostridium tetani, the second method, either it can reach the through the bloodstream, or it can travel through the axon cylinders. So it can travel travel through the motor nerves along their axon cylinders, and finally they are going to reach to the spinal cord. So do remember, from the motor end plate, the neurotoxins, the toxins of the Clostridium tetani, they are going to reach to the spinal cord, and finally they are going to fix where? They are going to fix at the motor cells of the anterior gray horn of the spinal cord. Do remember, the toxins of the tetanus, it is going to get fixed. It is going to travel through the axon cylinders, and they are finally going to fix to the motor cells of the anterior gray horn of the spinal cord. So ultimately, what is going to happen is these toxins, they are going to fix to the motor cells of the anterior horn of the spinal cord. Now, one thing very, very important, what I would like to lay stress on, that once this toxin has got fixed on the motor cells of the anterior gray horn of the spinal cord, its level, its value, it cannot be detected in the cerebrospinal fluid. Now, once this toxin has got fixed over there, it is no longer detectable in the cerebrospinal fluid. So if the spinal cord, from the spinal cord, the spinal fluid has been taken off, it will no longer, the tetanus toxin won't be appearing in the spinal fluid. So the cerebrospinal fluid, once it is fixed to the anterior horn, it won't be discernible, it won't be detected in the cerebrospinal fluid. And the other fact, what I would like to lay stress upon, is that once fixed, the next thing what is there is that even if no amount of anti-tetanus serum, once the toxin has fixed itself on the anterior horn, no amount of anti-tetanus serum can neutralize this toxin. Do remember, this is very, very important, distinguishing, striking fact that has to be remembered. All right, once the toxin has got fixed onto the anterior horn of the motor cells of the anterior horn, what is going to happen is there is no amount of anti-tetanus serum got fixed. It won't be discernible, it won't be detected in the cerebrospinal fluid, and next, no amount of anti-tetanus serum can neutralize this toxin. Now moving on, and how it is going to cause the reflex spasm of the muscle. So once the toxin has got fixed over there, what it is going to happen is it causes the extreme hyper-excitability of the motor neurons. Now, the hyper-excitability of the motor neurons will occur, thereby evoking a widespread reflex spasm of the muscles. Now, the hyperexcitability of the motor neurons will take place, and that will ultimately cause the evoking a widespread reflex spasm of the muscles when the concerned areas, it can be whichsoever area. Now, this was the mechanism as to how the toxin, what are the types of toxin? That is the tetanospasmin and the tetanolysin, and how this toxin gets spread and how it elicits its action. Now, moving on to the period of onset. So students, do remember, when looking at the period of onset of this tetanus, so how do you define this period of onset? So the period of onset of tetanus is defined as the interval between the first symptom. Okay. How do you define the period of onset of tetanus? So interval between the first symptom and the first reflex spasm. All right. So the first symptom when it is going to occur and the first reflex spasm when it is going to occur. This period is known as the period of onset. And do remember, if this period of onset, if this interval between the first symptom and the first reflex spasm is less than 48 hours, this can even be fatal. This can even cause death. Now, moving on. Okay, moving on to the types of tetanus. So in the MCQs, they most frequently asked you what is this tetanus, what is urban tetanus, what is tetanus neonatum, what is the post-abortal tetanus, what is this trismus, what is rhizus sardonicus. So slowly we'll move on as to what are the specific terminologies what are associated with it. So first, the first thing, what is urban tetanus? So urban tetanus, this is mostly seen in the most developed countries. So whatever the developed countries of the world are, the US, the Canada, the Western countries, the US, these countries, the tetanus what is occurring in these developed countries as a result of narcotic addiction. So where the people are more used to or more prone to narcotics, they are habituated narcotic drug abusers. So narcotic addiction, when it is there, such a tetanus, if such a tetanus appears, that is called as an urban tetanus. Moving on to the next, now the another very important term, it is the tetanus neonatum. All right, so what is this tetanus neonatum? Do remember, tetanus neonatum, the word itself is suggesting that it is going to affect the newborn babies. Now, during whenever any kind of a it results, this tetanus neonatum, it occurs when the contamination of the umbilical cord or the cut surface of the umbilical cord of the baby is infected with such a kind of a bacteria. So tetanus neonatum, it is mostly seen, it is mostly manifested in the newborns in which the contamination of the cut surface of the umbilical cord is there, and it is the most common cause of the infant mortality in most of the developing countries like India. All right, in developing countries like India, the most common cause of the most important cause, you can say, the cause, one of the most important cause of infant mortality in developing countries, it is the tetanus neonatum. And how the newborn baby dies. So in tetanus neonatum, the young baby, the newborn baby, there occurs severe spasm of the respiratory muscles. So the newborn baby whose umbilicus, the cut surface of the umbilicus has been infected, or the cut surface of the umbilical cord has been contaminated with such a bacteria. So if tetanus is going to occur in the newborn, this causes severe spasm of the respiratory muscles, and that becomes the cause of the infant mortality. All right, so the two types we have discussed. One is what is the terminology, that is urban tetanus, and next is the tetanus neonatum. Now moving on to the third, that is the post-abortal tetanus or the puerperal tetanus. So the puerperal tetanus, so most commonly what is seen is that this kind of a post-abortal tetanus, mostly after a childbirth. So after a childbirth, if there is during the procedure, during the cesarean delivery, what is going to happen is if there is use of unsterile, if there is unsterile manipulation or instrumentation during abortion or during a labor. So if unsterile instrumentation is there, if unsterile manipulation is there, it can even affect the mother as well, who's giving birth to a baby, who's giving birth to a infant. So during after the abortion or after the delivery, the tetanus, post-abortal tetanus, is mostly seen in the mothers who have been exposed to unsterile manipulation or instrumentation during the procedure of childbirth or during abortion. So this was the third type, that is the post-abortal tetanus or the puerperal tetanus. Now moving on to what is latent tetanus. This is very, very important. Sometimes students, what happens is that wounds are so trivial. The wounds are such of minor insignificant wounds are there. So in cases when sometimes the wounds are so trivial that they are mostly forgotten. People don't remember that minor cut was there, minor wound was there. Who's going to remember them? Who's going to have that ATS serum, anti-tetanus serum injections? So no one bothers at that time. Now what happens is the wounds, when they are so trivial, they are such of a minor or insignificant, what happens is they are mostly forgotten. People forget, mostly they forget. Now what happens is after months or years, so after few months or years, what happens is when the right conditions develop. So when the right conditions develop for the Clostridium tetani to multiply, all right, then the bacteria, the Clostridium tetani, starts multiplying and tetanus develops. So this kind of a tetanus, where there is such a long period between the injury and the appearance of tetanus, and when tetanus is in the hidden form, it manifests after a really long time, whether it be months or years. So such a tetanus, when it manifests after such a long period of duration, it has been called as the latent tetanus. And moving on to the most important thing, it is the trismus. So tetanus, in the layman term, they have been called as the locked jaw. And this locked jaw, it is the earliest symptom. Do remember, during any patients, if they are in the questions, if they are asking you what is the earliest symptom of tetanus, so the earliest symptom of tetanus is the locking of the jaw or the trismus. Along with the locking of the jaw, what is going to happen is there can be pain. The patient may manifest with pain and stiffness of the neck, the back, as well as the abdomen. So there can occur stiffness of all these three parts along with the locking of the jaw. So this is the earliest symptom of tetanus. Moving on to the next important terminology, that is rhizus sardonicus. So what is this rhizus sardonicus? So rhizus sardonicus, it is a characteristic in which the patient has an anxious expression. The patient has an anxious expression of the tetanus patient is going to show an anxious expression. And why is this being shown? Due to the spasm of the muscles of the face and jaw. Since the muscles in tetanus, the tetanus patient is going to have spasm of the muscles of the face and the jaw. So what is ultimately going to happen is there is going to be appear that it will appear as the patient is having a very anxious expression. So this is the rhizus sardonicus. It is characterized by the presence of an anxious expression of the tetanus patient due to spasm of the muscles of the face and the neck, of face and the jaw. Now, moving on to the next important terminology, that is what is opisthotonus. So opisthotonus. So what is there is, there in the condition of opisthotonus, what is going to occur is, there is going to occur the rigidity of the muscles of the neck, the muscles of the trunk, they are going to get rigid. Along with it, the back of the patient becomes arched, it becomes drooped, it becomes bent. So the back of the patient is going to be a little bit back, is arched. Along with, there can occur the rigidity of the muscles of the neck and trunk. So students, this was a very short discussion about the most frequently asked questions. If tetanus is being coming in any of the competitive exams, the most common MCQs what are being asked, this can be from any of the topics, any of the points what I have discussed here. Students, if still you do have any queries or comments, you're most welcome to comment me in the comment section. And students who are new to my channel and they haven't subscribed yet, go do subscribe my channel, and don't forget to press the bell icon so that you can be further updated for my coming videos. Thank you for watching.